Now, gradually over the years, things have improved, and some measures have been taken so as to curb down the flows of these international trials with registries, whereby the companies had to publish their trial protocols before actually starting the trial. It's a way to make sure that the company then, once the results and the outcomes are published, you can then check and compare this with the protocol. For instance, let me give you an example of something that really drifted away. Like you take the primary endpoint for an RCT, and you've got secondary endpoints, but in the article that is published, they focus only on secondary endpoints. And if you are not an expert, or if you are not too demanding, in fact, you just miss it completely. And all the more so because originally the protocol didn't include or didn't focus on the secondary endpoints, whereas now, because you know about the protocol that is due to take place, you can identify this sort of manipulations. To make a comparison with what you just said and the trial conducted for HCQ, for hydroxychloroquine, and the other trials carried out by the pharmaceutical industry, you are telling us that these people are judge and party, whether they are private or public. There is this original bias because of course, they've got a vested interest in the outcome of the trial. And irrespective of the precautions taken, if you just leave the pharmaceutical industry a free rein to do whatever they please, like for instance vaccination, the overall budget is 10 billion euros. Of course, 10 billion euros split across 5 companies with this new vaccine. And it's a lot of money, and one would kill for far less than $10 billion. And you were referring to the fact that the public authorities or the publicly funded trials wouldn't be a solution or wouldn't solve all problems. Yes, of course, you're right, because the confirmation bias would be built in as well. Of course, if the same people that came up with the chemical entity also conduct the trials, well, of course, there is indeed a bias. Though one must say that the most poorly done registries are the registries presented by French public health organizations. It's one of the flows of the French research. But you have to remember that it's either you publish or you perish. And it's true that for academics, in French hospitals, it means publishing or not being promoted. So, of course, the longer the list of papers, of articles you've been able to publish, well, the higher up you'll go. And it's also a way to get a budget, to get access to public money, to public funds. And one knows that Professor Raoult's team is benefited greatly from that, because all these publications have meant that his institute got 11 million euros for the organization, his institute in Marseille, which is a public institute. It's a public body. Now, a lot of Professor Raoult's publications are not in first-rate journals. However, they do bring in some cash. They are fraught with errors and mistakes, these papers, these articles. There was an article, a paper published in the newspaper Libération a few weeks ago, signed by academics saying, well, it's totally rubbish to give money to these academics on the basis of the number of articles they've been able to publish, because there's no control whatsoever. So in line with what you were saying, Ronnie, in order to make sure that either the academics, the hospital researchers, or the pharmaceutical firms do not tweak their studies, their trials, you can rely on registries. Furthermore, you know that in an article, everything is made very concise. For instance, you may see that 10% of these patients presented with that effect or this one. But what you can do is to drill down and check more precisely. And this is what you can do